Hello, good morning, friends. Welcome to our channel Lab Tech World. Myself Kishore Waghani, and today we are going to discuss UPSSSC, that is Uttar Pradesh Subordinate Service Selection Commission Lab Technician exam question paper. This exam was held on 20th November 2016, and we should be thankful to Arun Shukla, a regular viewer of our channel Lab Tech World from Uttar Pradesh, for sharing this rarely available question paper exclusively on Lab Tech World for all of you. And before starting the solution of this question paper, I would like to request, if you are new to my channel, then please subscribe my channel Lab Tech World and press the bell icon to enable all notifications for my next upcoming videos, because in this channel I am regularly uploading the videos of MCQs and previous year question paper with solution. That is going to be very helpful for those who are preparing for the upcoming lab technician exams like GPSSB, NHM and OSSSC lab technician exams. So it is my kind request to watch the complete solution of this video. This question paper contains total 80 questions. First 40 questions are related to the general knowledge, maths, reasoning and Hindi language and grammar, and last 40 questions, that means from question number 41 to 80, are the questions related to the field, that is lab technician field related questions. So without wasting your precious time, we will start with the question number 41. Question number 41. HB appears in which stage of development of erythrocyte? And the options are: A, early normoblast; B, intermediate normoblast; C, late normoblast; D, reticulocytes. And the fact available regarding this question, it is HB is synthesized inside developing red blood cells during the intermediate normoblast stage. So as per the information, option B, intermediate normoblast, will be the correct answer for this question. Move to the next question number 42. Oxygen flow rate of nozzle cannula is normally: option A, 1 to 4 liter per minute; B, 6 to 8 liter per minute; C, more than 6 liter per minute; D, none of these. The fact available regarding this question, it is oxygen flow rate of nozzle cannula is 1 to 4 liter per minute, as rate above the 4 liter per minute can dry mucous membrane and cause discomfort and bleeding. So it is generally about 1 to 4 liter per minute. Option A will be the correct answer for this question. Move to the next question number 43. Culture medium for fungus is: option A, tellurite medium; B, NNN medium; C, chocolate agar medium; D, subrods medium. And the fact available regarding all these medium and all these options are: tellurite medium is the special medium used for the cultivation of or culture for Corynebacterium species, whereas NNN medium, that is Novi McNeil Nicol media, is a culture medium used for the Leishmania and Trypanosoma species, whereas chocolate agar is an enriched medium used for the culture for some fastidious pathogens, and subrods medium is the culture medium used for the fungi, especially dermatophytes. So option D will be the correct answer for this question, that is used for the culture of, that is the culture medium of fungus. So option D will be the correct answer for this question. Move to the next question number 44. Central venous line is not done in: option A, internal jugular vein; B, subclavian vein; C, cephalic vein; D, femoral vein. And the fact available regarding this question, it is central venous line, also called as central venous catheter, is a tube that doctor place in a large vein in the neck, chest, groin or arm to give fluid or medication or for test purpose. And for this vein that are used are internal jugular vein, subclavian vein, and most commonly it is femoral vein used for this purpose. It is cephalic vein that is not used for the central venous line. So option C will be the correct answer for this question. Move to the next question number 45. Ambient temperature of an operation theatre should be: Option A 16 to 18 degrees Celsius, B 18 to 22 degrees Celsius, C 22 to 24 degrees Celsius, D 24 to 26 degrees Celsius. And the correct answer for this question should be generally 18 to 22 degrees Celsius is the ambient temperature for an operation theater. So option B will be the correct answer for this question. Move to the next question, number 46. Annexin 5 is a marker of option A apoptosis, B necrosis, C inflammation, D hemostasis. And the fact available regarding this question, it is annexin 5 is a calcium binding protein which is widely used as a marker for apoptosis. Apoptosis is a type of cell death in which series of molecular steps in a cell that leads to its death. So from the given information, we can say annexin 5 is a marker of apoptosis. Option A will be the correct answer for this question. Move to the next question, number 47. Which of the blood component to be kept in gentle agitation for preservation? And the options are A cryoprecipitate, B factor 8, C platelet, D FFP, that is fresh frozen plasma. And the fact available regarding this question, it is in blood bank platelets are stored in large flat bags with high surface to volume ratio and on agitators to facilitate oxygen diffusion. So from the given information, we can say it is option C platelet is the blood component that is to be kept in the gentle agitation for preservation. So option C will be the correct answer for this question. Move to the next question, number 48. Normal blood urea level is option A 8 to 24 milligram per deciliter, B 15 to 40 millimole per liter, C 5 to 14.3 milligram per deciliter, D 2 to 5 millimoles per liter. And the information available regarding this question, it is 8 to 24 milligram per deciliter is the normal range for blood urea nitrogen, whereas the normal blood urea level is 15 to 40 milligrams per deciliter. We have to convert this milligram per deciliter into millimole per liter. The answer is 2.5 to 6.5 millimoles per liter is the normal range for blood urea in millimoles per liter. So as per the information, we can say option D 2 to 5 millimoles per liter will be the correct answer for this question. Move to the next question, number 49. Epinephrine added to a solution of lidocaine for local anesthesia will option A cause cyanosis locally, B increase the risk of convulsions, C increase the duration of local anesthesia, D increase the absorption of lidocaine. And the fact available regarding this question, it is the addition of epinephrine to lidocaine increases the time required for peak lidocaine concentration. Generally, the concentration of lidocaine in mucosa peaks around 10 minutes after application. When epinephrine was added, lidocaine concentration peaks around 40 minutes. So duration of the peak concentration of lidocaine is being increased by adding the epinephrine in the lidocaine. So from the given information, we can say it is option C will be the correct answer for this question. That means epinephrine added to the solution of lidocaine to increase the duration of local anesthesia. So option C will be the correct answer for this question. Move to the next question, number 50. Gram positive anaerobes is option A Neisseria, B Corynebacterium, C Clostridium, D Haemophilus. Talking about all the four options, Neisseria is the gram negative aerobes, whereas Corynebacterium is a gram positive aerobes, and Clostridium is an gram positive anaerobes, and Haemophilus are the gram negative aerobes. So we can say it is option A, C and D are the examples of aerobes, whereas Clostridium is the only example that is a gram positive anaerobe. So option C will be the correct answer for this question. Move to the next question, number 51. In cardiac cycle, left ventricular systolic phase is about option A 0.1 second, B 0.3 second, C 0.7 second, D 0.8 second. And the correct answer for this question, it is generally around 0.3 second. So option B will be the correct answer for this question, and you have to remember the correct answer for this question. Move to the next question number 52. Half-life of a drug may be helpful to determine option A, dosage schedule of drug, B, level of absorption, C, time to get the steady state, D, distribution into distribution into body system. And the fact available regarding this question, it is half-life of a drug is useful for determining the excretion rate as well as the steady state concentration for any specific drugs. So from the given information we can say it is option C, time to get steady state will be the correct answer for this question. Move to the next question number 53. A patient is present with watery diarrhea. Which culture medium will you used for stool? And the options are A, Carry-Blair medium, B, Pepton agar, C, TCBS agar, D, McConkey agar. Fact about all these four options: Carry-Blair medium and Pepton agar are the transport media, whereas TCBS agar is a selective and differential media, highly selective for Vibrio cholerae that causes the watery diarrhea, and McConkey agar is a differential media used to differentiate lactose fermenting and lactose non-fermenting microorganisms. So from the given information we can say it should be TCBS agar should be used for such patients. So option C will be the correct answer for this question. Move to the next question 54. Uric acid in presence of uricase enzyme converts to option A, alanine, B, allantoin, C, purine, D, pyrimidine. And the fact available regarding this question, it is enzyme uricase converts uric acid into allantoin, and the microorganism that possess this enzyme is E. coli, Proteus mirabilis, and Bacillus pasteuris. So from the given information we can say option B will be allantoin will be the correct answer for this question. Move to the next question number 55. Which is not a branch of abdominal aorta? And the options are A, renal artery, B, superior mesenteric artery, C, ovarian artery, D, profunda femoris artery. And the fact available regarding this question, it is renal artery, superior mesenteric artery, ovarian artery. All these arteries arises from the abdominal aorta, whereas profunda femoris artery is the artery that supplies blood to the thigh and arises from the posterolateral aspects of the femoral artery. So it is arises from the femoral artery, not from the abdominal aorta. So option D will be the correct answer for this question. Move to the next question number 56. Which among the following is a sterilization procedure? And the options are A, heat, B, alcohol use, C, betadine painting, D, antiseptic. And the correct answer for this question, it is option A, heat is the example of procedure for the sterilization, which is further subdivided into two: dry heat sterilization and moist heat sterilization. So option A will be the correct answer for this question. Move to the next question number 57. Which is the hand hygiene product of choice for all standard aseptic non-touch technique, ANTT? And the options are A, alcohol based hand rubs, B, soap and hot water, C, soap and warm water, D, soap and plain water. And the correct answer for this question, it is option A, alcohol based hand rubs are the hand hygiene product of choice for all standard aseptic non-touch technique. So option A will be the correct answer for this question. Move to the next question number 58. GIT infection transmission by fecal-oral route may be option A, waterborne, B, foodborne, C, hand infection, D, all of these. And the fact available regarding this question, it is GIT, gastrointestinal tract infection transmission by fecal-oral route is fecal material taken into the mouth through contaminated food or water or finger, and the bacteria or organisms that are transmitted through this fecal-oral route are E. coli, Salmonella, Shigella, Giardia, and hepatitis A. So from the given information we can say GIT infection transmission by fecal-oral route may be either waterborne or foodborne or from the finger or hand infection. So option D, all of these will be the correct answer for this question. Move to the next question number 59. BMR is option A, basal metabolism rate, B, bile measuring ratio, C, body mass ratio, D, body measuring ratio. And the fact available regarding this question, it is BMR is a basal metabolism rate, or basal metabolic rate is the number of calories your body uses to maintain the vital functions like breathing, heart rate and brain function. So the full form of the BMR is option A, basal metabolism rate or basal metabolic rate. Option A will be the correct answer for this question. Move to the next question number 60. Product of HMP pathway is option A, deoxyribose, B, pentose sugar, C, glucose, D, amino acid. Fact available regarding this question, it is the HMP pathway is an alternative pathway to glycolysis and is used to produce ribose 5-phosphate and nicotinamide adenine dinucleotide phosphate, that is NADPH. It occurs in oxidative as well as non-oxidative phases. So we can say the product of HMP pathway is ribose 5-phosphate, that is a pentose sugar. So option B, pentose sugar, will be the correct answer for this question. Move to the next question number 61. In the transmission of malaria, mosquito bites transfers option A, sporozoites, B, merozoites, C, gametocytes, D, hypnozoites. And the fact available regarding this question, it is malarial infection begins when an infected female Anopheles mosquito bites a person, injecting plasmodium parasite in the form of sporozoites into the bloodstreams. So from the given information, we can say it is the sporozoite. Option A is the form of malaria that is transmitted through the bite of mosquito to the human being. So option A will be the correct answer for this question. Move to the next question number 62. Speech receptive area of brain is option A, Broca's area, B, Wernicke's area, C, temporoparietal lobe, D, speech area. And the fact available regarding this question, it is in brain, speech area is generally divided into two areas. One is Broca's area, second is Wernicke's area. Broca's area has motor neurons for speech production, whereas Wernicke's area contains the neurons to receive the signals of speech. So from the given information, we can say it is Wernicke's area. Option B is the area that is the speech receptive area of the brain. So option B will be the correct answer for this question. Move to the next question number 63. Insulin dependent glucose uptake is done through option A, glucose transporter 1, B, glucose transporter 2, C, glucose transporter 3, D, glucose transporter 4. Fact available regarding all this transporter is glucose transporter 1 is associated with the bidirectional transport of glucose. Glucose transporter 2 regulates the entry and exit of glucose to and from the cell, whereas glucose transporter 3 is generally present in the brain. Talking about glucose transporter 4, it is an insulin responsive glucose transporter found in the heart, skeletal muscle, adipose tissues and brain. So from the given information, we can say that the insulin dependent glucose uptake is done through the glucose transporter 4. Option D will be the correct answer for this question. Move to the next question number 64. Most tissues is to be preserved in option A, 10% formalin, B, 40% formalin, C, 5% formalin, D, bounce fluid. And the fact available regarding this question, it is most tissues is to be preserved in 10% buffered formalin that is prepared from the 40% stock solution of formalin. So option A will be the correct answer for this question, but as per the answer key, they have given option B, 40% formalin, as the correct answer. So you can correlate the correct answer as per your own knowledge. As per my best knowledge, it should be option A, 10% formalin will be the correct answer for this question. Move to the next question number 65. Hemophilia is a bleeding disorder occurring in option A, only male, B, only female, C, both male and female, D, in child. And the fact available regarding this question, it is hemophilia is an inherited bleeding disorder that slow down the blood clotting process that primarily affects male, but female also have been hemophilia as a carrier of it. It is generally divided into two subtype: hemophilia A, that is also known as the classic hemophilia, that occurs due to the deficiency of clotting factor 8, and second, that is hemophilia B, also known as the Christmas disease, due to the deficiency of clotting factor 9, also known as the Christmas factor. So we can say it is the disorder, bleeding disorder, occurring only in the male. Female are only the carrier of this disease. So option A, only male, will be the correct answer for this question. Move to the next question, number 66. In preparation of Leishman's stain, 0.15 gram crystals of eosin methylene blue is dissolved in 100 ml of methanol is dried at option A 50 degrees Celsius, B 56 degrees Celsius, C 60 degrees Celsius, D 66 degrees Celsius. And the fact available regarding this question, it is Leishman stain preparation where 0.15 gram crystals of eosin methylene blue is dissolved in 100 ml of methanol is dried at 50 degrees Celsius for 15 minutes to dissolve this complete all the crystals of the stain in the methanol. So option A 50 degrees Celsius will be the correct answer for this question, but as per the answer key they have given option B 56 degrees Celsius is the correct answer for this question, but as per my best knowledge it should be option A will be the correct answer for this question. Move to the next question, number 67. Water seal drainage system is used for option A treatment of hemoperitoneum, B treatment of abscess, C treatment of pneumothorax, D none of these. And the fact available regarding this question, it is water seal draining system, also known as underwater seal chest drainage system, allows the drainage or removal of pleural air, blood and other fluid to allow the re-expansion of lung, especially in pneumothorax or collapsed lung. So we can say the correct answer for this question, it is option C. It is used in the treatment of pneumothorax. Option C will be the correct answer for this question. Move to the next question, number 68. The ICMR recommendation of protein intake for adult is option A 1 grams per kg body weight, B 2 grams per kg body weight, C 3 grams per kg body weight, D 4 grams per kg body weight. And the fact available regarding this question, it is the ICMR recommendation for protein intake for adult is generally around 0.8 to 1 grams per kg of body weight. So from the given information we can say option A 1 grams per kg body weight will be the correct answer for this question. Move to the next question, number 69. Vitamin K is useful for option A for physiotherapy, B chemotherapy, C coagulation of blood, D none of these. And the fact available regarding this question, it is vitamin K is important for blood coagulation and in healthy bones. So from the given information we can say option C coagulation of blood will be the correct answer for this question. Move to the next question, number 70. Which type of condition is directly related to the bone marrow suppression? And the options are A aplastic anemia, B anemia, C sickle cell anemia, D megaloblastic anemia. And the fact available regarding this question, it is aplastic anemia is defined as a decrease in the ability of the bone marrow to produce enough blood cells. So we can say it is aplastic anemia is the condition that directly related to the bone marrow suppression. So option A will be the correct answer for this question. Move to the next question, number 71. Rate limiting step in catecholamine biosynthesis is catalyzed by option A dopa decarboxylase, B tyrosine hydroxylase, C dopamine beta hydroxylase, D phenylethylamine and methyl transferase. And the fact available regarding this question, it is tyrosine hydroxylase catalyze the synthesis of dopa, that means L dihydroxyphenylalanine from the tyrosine. That is the rate limiting steps for catecholamine biosynthesis. So from the given information we can say it is Option B, tyrosine hydroxylase is the correct answer for this question. Move to the next question number 72. All are true about hematoxylin except option A, it stains tissue blue, B, basic, C, stains positively charged structure, D, none of these. And the fact available regarding this question, it is hematoxylin is the stain that stains the nucleus blue or purple. So option A will be the A statement will be the correct. It is also a basic dye, so option B will be also the correct. Option C, stains positively charged structure. And the fact available regarding this option, it is hematoxylin is a positive charge structure, so it will stain the negatively charged structure. So option C will be the wrong statement regarding the hematoxylin. So option C will be the correct answer for this question. But as per the answer key, they have given option D as the correct answer for this question. Move to the next question number 73. False about CPR is option A, ratio of ventilation with chest compression is 15:2 in adult. B, number of chest compression is 100 per minute. C, asystole is an indication. D, requires more than one person. Fact available regarding this question, it is CPR, cardiopulmonary resuscitation, is a life-saving technique that is used in many emergencies like heart attack. Okay, so and this fact regarding this CPR is, in CPR the ratio of ventilation with chest compression is 2:15 in adult. Number of chest compression is 100 per minute. Asystole is an indication of the CPR, and it can be done with CPR can be done with one person or with two persons. So it requires more than one person. It is also correct. So the wrong statement regarding the CPR is ratio of ventilation with chest compression is 15:2 in adult is the wrong statement regarding the CPR. So option A will be the correct answer for this question. It should be ratio of ventilation with chest compression is 2:15 in adult will be the correct for this statement for the CPR. So option A will be the correct answer for this question. Move to the next question number 74. Which of these is a phagocytic cell? And the options are A, RBC, B, macrophage, C, lymphocytes, D, platelets. And the various examples of phagocytic cells are monocytes, neutrophils, mast cells, and tissue dendritic cells. So from the given information, we can say it is option B, macrophage are the examples of phagocytic cells. So option B will be the correct answer for this question. Move to the next question number 75. After blood donation, RBC is replaced in adult healthy male within option A, 10 to 20 days, B, 20 to 30 days, C, 30 to 50 days, D, 40 to 60 days. And the fact available regarding this question, it is after blood donation, it requires 48 hours to replace the blood volume and 4 to 8 weeks, that means around 30 to 50 days to replace the whole red blood cells. So from the given information, we can say option C, 30 to 50 days will be the correct answer for this question. Move to the next question number 76. In color Doppler, the color depends on option A, strength of returning echo, B, relation of transducer to blood flow, C, frequency of Doppler used, D, type of Doppler machine used. And the fact available regarding this question, it is in color Doppler, the color depends on the direction of blood flow in respect to the transducer. That means if the flow towards the transducer is depicted as red, while blood flow away from the transducer is shown in blue. So it is relation to transducer to blood flow is the decides the color of the color in color Doppler. So option C will be the option B will be the correct answer for this question. Move to the next question number 77. Most abundant catecholamine in adrenal medulla is option A, isoproterenol, B, dopamine, C, norepinephrine, D, epinephrine. fact available regarding this question, it is epinephrine is 5 times greater than that of the norepinephrine, that is the most abundant catecholamine in the adrenal medulla. So from the given information we can say it is option D, epinephrine is the correct answer for this question. Move to the next question, number 78. Pathogens are destroyed by option A, kidney, B, liver, C, lymphatic tissues, D, tonsils. And the fact available regarding this question, it is tonsil contains high concentration of lymphocytes that are responsible for the killing of germs. So we can say it is option D, tonsils that kills the pathogens by limiting their entry into the body. So option D will be the correct answer for this question. Move to the next question, number 79. Vidal test is done for the diagnosis of option A, measles, B, cholera, C, diphtheria, D, typhoid. It is also one of the easiest question, and the correct answer for this question, it is Vidal test is done for the diagnosis of typhoid. So option D will be the correct answer for this question. In addition to this, we have to remember that modified LX test is the test that is done for the diagnosis of diphtheria. So for diphtheria you have to remember LX test can be asked in another way. Move to the next and final question of this question paper. Question number 80. Montek's test reading is taken after option A, 12 hours, B, 24 hours, C, 48 hours, D, none of these. And the fact available regarding this question, it is Montek's test reading is taken generally after 48 hours of the testing. So option C, 48 hour will be the correct answer for this question. It can be read after 3 to 4 days also, but generally it is reading is done after the 48 hours. So option C will be the correct answer for this question. That's all for the today. Thank you for watching the video. Please subscribe our channel Lab Tech World, and if you like our work, then like and share our videos with your friends. Thank you very much.